probably would have punched somebody in the mouth if they said I would have been a social worker first, first and foremost. I hated social workers. I felt like they always let me down. And anytime I had an interaction with a social worker, it was terrible. They never helped me. They either got me in trouble with my family, they called me liars. I viewed like police officers and social workers in the same category. So, when I was incarcerated at 18 years old, I went to a step-down facility, and it was the first time I kind of seen like cognitive behavioral therapy programs, and I was thinking like, man, there was like some people like me, because back then, just my community, I didn't see a lot of people with records, with degrees. You see guest speakers and stuff, but I didn't see a lot of people like me, that knew, they weren't just like looking out of a textbook like cannabis smells like this, It was, and I remember there was a social worker there from a local suburb, and she was literally reading out of the textbook about how weed smells like with a bunch of, 30 convicted felons, and we were all kind of like laughing and stuff. And I thought like, man, if that was me, I'd be able to tell them exactly what to do, what to think, what to change. I'm gonna become a social worker. And everybody shut me off. Like, man, shut that young kid shit off. I was like, no, I think I could do it. I was still in my GED classes and had a 6th grade reading level, and nobody in my family like had a professional degree. And and I kept asking my teachers, and there was this case manager there that always, said I'd never be shit and stuff. And I was like, how do I become what are you guys? And they're like, we're social workers. And I was like, okay, but what do you guys do? I just kept thinking like, if I could do what they did, So I got enrolled at the University of Toledo by another guy who had a criminal record, Dr. Morris Jenkins, a guy named John Edwards, the head CEO of UMaDOT in Toledo. I remember him telling me this. He's a father figure to me, and he was, he was like, Jacob, if you get a degree, you get a job anywhere. And I was so low on myself, like at that time, I was like, I can't even get in the factory now. How the hell am I going to get a job? And he bought me a college scholarship book, and I remember out of his own pocket. And I remember like just that kindness of his heart, and he told me all his 7 kids had college degrees, all 7 of them. And I was like, wow, like that changes generations, so it was really empowered for me. And I just had this vision, in my head of like helping felons across the whole world, and I couldn't like explain it, but I just knew, I don't know, I just had like this spiritual awakening, a couple times while I was in jail, like I could really change the system, and step by step, internship and more education and volunteering. I just helped my cousins and friends and family that got out of incarceration or drug addiction, just help them get a pair of work boots. And I turned that into big programs. And, that's how I kind of really got into the field. Started just talking to kids, and I started collecting urines, and I got a CDCA. It took me forever, to get these things. It took me like 2 years to get a CDCA. It took me, just really having those opportunities. And I started running groups, worked myself up to a social worker, manager. Now I'm, own a whole agency now. Like not feeling, like internally I would feel like I'm too young. Like it was weird because like my story's too abrasive for most people. Like I'm not your typical, like even when I went to college, I was everybody's age, but I wasn't a traditional student, I had like the story of every adult that was in recovery, but I was too young. So I'd always get slack for being the youngest kid. And, people would always be like, hey, clients get out of this room. And I'd be like, I'm staff, shit, and I'd always be more qualified than everybody else. I'd always get the most slack. So I always felt like I was the underdog in the field. Still young now, for the job I have. Another barrier, I would say the record was a hindrance, but as I got older in my career, I'd just always be like, if they didn't hire me because of my record, that's their fault. Their loss, And anytime I didn't get a job, I always got a way bigger opportunity, and God always blessed me, 10 times more. Another barrier, I would say politics. you know, you're trying to change the system and you think like all these people on board, you got 100 people on board, 100 people on board, and you go make a change, and they weren't really about it. People just getting big salaries and grants, and they're not really trying to help people. They just say they're helping people, you know. So it's like when you go up against a system, you know, that's why I'm not real big on like working in the prison system or working in this system or working, because it's hard to change it within it, you know, because you get a lot of slack. You know, you can be at peace in that system. You get employee of the month or something like that, but you're not really able to make effective change. You know, there's a lot of moving parts, you know, to social work, you know, on different levels, macro, micro, meso, you know. You know, those are the biggest things. You know, other barriers, we just can't help people. You know, that's the stuff that keeps you up at night. Like you make a wrong decision, you know, you have to turn a kid into child care, or you have to turn a patient away, and you're like, well, if I keep helping them, you know, and they keep using, are you making their situation worse? If you kick them out, they die, they go to jail, or sometimes they go to jail and they get better. Like those are the things I struggle with all the time. It's like really strategic. You know, you give a patient the wrong medicine, you know, like that's the stuff that's kind of barriers. Programs you want to do, but you know, insurance companies don't want to pay for it, something, so you got to be creative. You know, I'm pretty smart at that type of stuff, but you know, that's the biggest barriers I see, you know, in my career. You know, I mean, I kind of like being the underdog, though. That's kind of my thing. You know, I'm sure I could be successful in any job that I do. I'm sure I could be a pharmaceutical salesman and make $300,000-$400,000. I'm sure I could be a car salesman and make $100,000. You know, and I say that just because, you know, I have the gift of gab. I can sell, I can do business stuff. You know, but you know, in the peak of my career, like it's just been it's been hell. Like, you know, so the reason I prepped that question is, you know, in 2019, you know, I started getting very sick. Like my mental health was going out of control. I was diagnosed with bipolar disorder, even though I was in the field for like 7 years at that time. I had to start seeing psychiatrists. I was in like depression stages where I couldn't get out of my bed for 3 days at a time. I didn't know what was going on. And then started, was that 2020? I'm at like the peak of my career, like peak of a career. Just launched another company, 28, maybe 27, 28. And I kept going to doctors, you know, and as a drug addict, you know, on your record, and as a criminal on your record, you know, the first thing sometimes people think is like pill seeking, or, you know, you're just young and healthy and stuff, but my nose would always leak. And they would just say, you know, maybe from the cocaine damage or the heroin damage, your nose is messed up. And I was like, this don't make no sense, you know, this don't make no sense. And I was like, I snorted cocaine for like 6 months. How is it just happening now? And I was running groups in hospitals, and my nose would start leaking all the time, and I lost 70 pounds. And like I didn't know at the time, but I couldn't breathe through my nose. I remember I was watching a podcast on like mindfulness because I was losing my mind. I was trying to, you know, not watch like typical mindfulness hippie stuff. You know, I was trying to find like some stuff, and I went like this, and I realized I couldn't breathe out my nose. And I kept going to doctors and specialists after specialists after specialists, and I finally got a CAT scan. And they said I had a nasal polyp in my nose, and I was like, they said, you got punched in the nose, you know, have you been in a fight? And I was like, yeah, you know, I've been in fights when I was younger. And, you know, this guy, they kept blowing me off, you know, he's like, I'm about to do the surgery. I kept like losing weight, and nobody knew what was going on with me, you know, and, you know, comes to find out, you know, I just kept feeling like something was wrong. You know, I just buried like my little nephew that passed away from leukemia and cancer, you know. It was just a real rough time. You know, I was taking care of my kids. Mental health off the chain, and then boom, I got an MRI, and I just knew like something was off. You know, all the women in the room were like franticking. They kept looking at my pictures. They're like, don't take pictures, sir. And of course I snapped it, took a picture. And I went up, me and my wife got in a huge fight. I was like, all right, I need to find a doctor. I started finding the best doctors in the world, and by the grace of God, I found a guy, Dr. Sawani at Cleveland Clinic. Right up to Cleveland Clinic, had to pay the second referral fee or whatever, and he's like, hey, these doctors in Toledo didn't do their job. They didn't send me the pictures. I don't know what it is. I'd love to take your money, but you're gonna have to come back. Do you got any pictures? And I was like, yeah, this. And he looks, and he says, Mr. Spellis, that's a brain tumor, cancer, or mass, and I don't think it's a mass. And I was like, a brain tumor? And it kind of like just sunk in, like, brain tumor, shit. And he's like, calm down, buddy. Me and my team do these every week, I was like, I don't know what I'm gonna do, We still didn't know what was going on, so we get the MRI. I remember we go back to the place in Toledo, and I remember going back into the building, and everybody's just on their computers. The office was never like that. It's always chaotic, and I was that kid that you see on the news, 3 kids, 28 years old, rarest cancer on the planet, has to walk in, they have to tell me that, Mr. Spellis, you have cancer. And I remember the whole time my wife's working ICU, and she kept telling me, like, hey, don't be shocked if I don't cry, because I see this stuff all the time, and she's like my hero. And the doctor said, Mr. Spellis, you have cancer. And I said, F it, all right, let's beat it. And I clapped my hands, and I turned, and my wife is just bawling. And I was like, oh, and I was stuck. And I was like, oh shit, And then I went out to my car, and everybody's blowing me up too, because this is the appointment that we knew something was going on. Everybody's blowing me up. My phone is going ape shit, and I don't want to talk to no one. And I just see my wife through my tinted window. She can't see me, and she's crying. I'm just like, I'm dead. Like, I did all this for nothing, I worked so hard, and that's when I kind of noticed, like, I wanted to take health, like, on another level, for us, not that I think everybody here has the most rarest chondrosarcoma cancer on the planet. I know there's only 100 cases a year or something, but, I took that moment of the way Cleveland Clinic treated me up there, like I was a person. Even the way they did anesthesia, they knew I had PTSD, and these slicksters would always be like, Jacob, you need to take a breath, like the football players, you deserve it. And I'm breathing like, yeah, and not knowing they're gonna pass me out because they just didn't want to scare me like that, And I take that motto that they have up there and I kind of implement it in my practice, but with people that never get services, So implementing the integrated care model is very important to me. Giving physical health, the best quality services to Medicaid patients, no matter what your insurance is. We serve Medicare, Medicaid. My big vision here is we're going to get into housing soon, residential, but really probably the next 2 to 3 years, I'm going to start trying to build the biggest behavioral health hospital in the nation. I don't see any hospitals that specialize in behavioral health, just like we see Cleveland Clinic and they got all the specializations, but I want to build a hospital where we bring in the most talent, kid psychiatrists, study that people travel all over the world to come see us. That's kind of one of my vision, I think the biggest bed we see now is 150 in the space, so I'm trying to set the biggest in the world, so that's kind of where my vision is, and I kind of want to build community-based treatment centers where they leave the hospitals and we follow them in north part of the town, south part of the town. So when they leave here, I think the biggest problem is that people got to go all over the place, but if we start building community centers there. Another vision of mine, I want to build a high school, for kids like me. I'm a high school dropout. We have 1.3, I think, million kids drop out of high school each year, and the research will say, high school dropouts, teen pregnancy, criminal justice system, drugs, alcohol, poverty, the rest of your life. I mean, the data's there. I mean, not be in poverty, all you have to, the research says, get married, have children, get a job. So it's like, if I could create a school where that's just what we do, we could save our communities so much. I think all the violence and stuff, people put so many programs, so many cool ass social work words, but it's like really simple. Like, dude, that's what we've done my whole career. Give people jobs, hope, opportunity, follow-up services. Like, it's not too much, so vital health, we're going to be a staple in our community, but I think we're going to be a national model here in the next 3 to 5 years.